Welcome to the HITea With Grace podcast, where we spill the tea on HIT. Today, I'm honored to welcome to the pod Dr. Amy Bucher, Chief Behavioral Officer at Lirio. Thanks for joining me, Amy.
Well, thanks so much for having me, Grace. I'm excited to talk to you.
So tell me a little bit about the career path that brought you to Lirio.
Yeah, it has been a winding road. I earned my PhD in psychology from the University of Michigan in 2006. Did not know what to do with that degree. And at the time, the type of job that I do didn't exist. So I never set out to become a chief behavioral officer or even do behavioral science in health IT. But I knew I wanted an industry job. And at the time, I was geographically bound because I had gotten engaged to my husband. He was still working on his doctorate at Michigan. So I didn't want to leave him. And I ended up finding a job in healthcare doing research for an agency. And that was the spark that got me into healthcare. I knew after that job, I never wanted to work outside of health again. There's just so much opportunity with using behavioral science to help people along their health journeys. But that job didn't quite help me figure out what those opportunities might look like for me. Then it was my second job. And again, it was one of those things I just lucked into. I was doing a competitive market analysis for my first job, and I found this online program called HITea Cares. It was for patients with diabetes who were on Takeda therapies. And for whatever reason, it wasn't properly gated. I assume you would have needed an access code, but I was able to just sort of log into it and use it. And I was like, this is awesome. It was a really personalized, obviously behavioral science-based coaching platform. And I Googled the company that made it. It turns out they were in Ann Arbor, 2 miles from my house. They had a job opening for a content developer, and I've always loved to write. So I applied for and got the job. That was health media. And that was it. That was where I got onto the digital pathway. It's where I really learned how to do design and be part of a digital team, thinking about the product and how do we take this behavioral science and turn it into something that is technical and scalable. And I would say from there, my path became much clearer because I knew that this was the space that I belonged in. So lots of other stops between them and in Lirio, but that's really where it all got started. And I think once I had that experience at Health Media, I knew that I was always looking for opportunities in digital health specifically. And that made it possible for me to get where I am today.
You are so interesting and you have such a unique role, Chief Behavioral Officer. So why is it important to have someone like that in an organization like yours? And what is that?
The simple answer is I lead our behavioral science team, but it's important because we're actually the tip of the spear when it comes to creating our product and the experience of our product for our clients. My team is the first one frequently that gets engaged with a client because if we are trying to nudge, say you're a health system and we're nudging your patients around healthcare, or you're a health plan and we're nudging your members to use their benefits in a particular way, we have to understand what that looks like for them. What is the behavioral pathway that we're trying to set people on? What makes it hard for them to traverse that pathway today? And what are the proven tactics and techniques that we can apply to make all of that easier so that when we ask somebody to take action, they can actually complete it? So having a chief behavioral officer, I think, gives us an official status in the product that I haven't always experienced in other jobs. I've certainly had jobs where we have to jockey to be part of that team that is interfacing directly with the client and having foundational input into how we develop our process. But there's something about saying no, we actually take this so seriously that we have a team with an executive leader. We've elevated this functionality to the top of the organization. I don't report to a product officer. I report to the CEO. And I think that speaks to the importance of behavioral science in our organization. And similarly, we have a chief AI scientist who also reports to the CEO. And together we co-direct our research lab. And again, it's a sort of a statement through organizational structure that these two skill sets they're not ancillary. They're really a core part of what we do.
Yeah, it's so interesting. Some people think it's harder to sell than to actually get people to use, but it's more important that people use. It's just as important that you sell and people use it, right? And a lot of the consumer health organizations and consumer organizations, they all have this, right? They all have folks that are focused on making sure people want to use their product and that it's very accessible and easy to understand. And so tell me a little bit about how can behavioral science play a role in transforming healthcare, especially as it relates to digital tools and digital transformation?
Yeah, there's so many ways to answer this, but because you were talking about getting people to use, one of the simplest front end ways of thinking about this that we talk about all the time at Lirio is engagement, and specifically little e engagement and big E engagement. So Heather Cole-Lewis and her colleagues at J&J, where I worked for a time. So this is sort of in my professional DNA, thinking this way too. I have a great paper that came out in, I want to say 2017, about thinking about engagement this way. But little e engagement is the sort of traditional design engagement. How do we create something digital that people want to use, that's easy to use, that creates designers roll their eyes at this, but that delights users. And we have to bring those tactics to bear. If we're nudging somebody and we're sending like a super boring nudge or something that's hard to read or feels irrelevant, like nobody's going to pay attention to what's inside that, and it won't work. If we do get them to pay attention to it, though, we have to capture big E engagement. And that's engagement with the actual behavior, with the thing that we're asking people to do. And that's a piece where behavioral science does have a special sauce, because a lot of times the reasons why people aren't doing things, it's not because they're not aware that this is a good action. Like most of us have a pretty good sense of what we should be doing to be healthier, but knowing is not the same as doing. And so it takes sometimes a lot of finesse, a lot of nuance to adequately address those barriers to behavior. And that's something that behavioral scientists are really good at. We can really diagnose what those barriers are. We can identify the right techniques to help address or overcome those barriers. And we build those into our product to get that big E engagement that is off the screen, which is also part of behavioral science too, right? It's not just considering what the product experience is, but it's thinking about how does this product experience tie into the person's life off the screen.
When we're thinking about fiscal solvency, chronic conditions, suboptimal patient engagement, like there's a lot of challenges in healthcare. So what do you think we should tackle first when you're thinking through this lens?
Yeah, that's so hard to say because we do have to tackle all of it. But as a behavioral scientist, one of the things I think about a lot is this idea of keystone behaviors and also the idea of self-efficacy. So one of the things that we do see a lot of times in our data, and this isn't unique to Lirio, you see this across the health ecosystem, is that a strong primary care relationship is associated with a lot of other positive health behaviors for patients. So whether it's getting your vaccinations or staying on top of your cancer screenings, the people who have that strong provider relationship are more likely to do those things. And we've even seen racial differences with this, where that provider relationship is even more important, for example, in Latina women when it comes to their mammographies. So if we can nudge people around that primary care relationship, I would always start there, just because my belief, and the data backs this up, is that that's kind of the first domino in breaking through some of these other areas. That's also easier said than done because, of course, there's primary care shortages and, that they're sometimes very difficult to get people in that space. So we've thought a lot about things like virtual care and alternative ways of connecting people with more preventative and primary care. The other thing, though, is thinking about self-efficacy on the patient side. So it's a psychological concept that comes from Albert Bandura. And it's this idea that if you can get a person to believe in their own ability to affect change in their life, they're more likely to try things. They're more likely to take a step because they feel more confident that it might work. And so when we design for behavior change, sometimes we deliberately ask people to do something that's kind of simple as a first step, because that gives us an opportunity to give them positive feedback and to help build that sense of self-efficacy so that we can ask them to take on something more challenging as a next step. So if we do have that primary care pathway available, for a lot of people, that's actually a less intimidating first step than something like a cancer screening or even managing a chronic condition. Of course, your primary care provider will talk to you about that. But if we come through with this guise of, hey, it's a good idea to see a doctor once in a while for a wellness exam, that doesn't feel as overwhelming for many patients. And so it might be that way to get the ball rolling on positive change.
So true and so interesting. So what does Lirio exactly do? And then how do you fit into the role that you're playing there at the organization?
We really think of ourselves as an intelligence and personalization capability, or a middle layer that can sit in between all of the ways that the healthcare organizations we work with are communicating with their population, whether that's members or consumers or patients. So we call our capability precision nudging. The way that we've historically shown up is with personalized messaging. So our first set of clients were health systems, and a lot of health systems are communicating through text message and email. So we have a lot of experience using those modalities. But the way that we text or email somebody is really around behaviors. We have specific actions that we want people to take. And the content has been selected by our AI from a library that my team builds that's all designed to be readable by that AI. So we're doing research and understanding for every behavior why people might not take action. What do we have to say to them from a behavioral science perspective to overcome those barriers? And then we build little Lego blocks of content that use those behavioral science techniques. That's what the AI is able to pick from and assemble an email or a text message. As we've grown more sophisticated, though, where the magic behind Lirio really is if you think about the more complex patient journey, because then it's not just personalizing what's in the specific message, but it's also starting to figure out, to the last little bit we just talked about, for an individual, what might that keystone behavior be? Where are they most likely to take action? We can start to personalize not just how we talk to people about things, but what we're even asking them to do. And then coordinating between all of the different requests that you have of any individual around their healthcare. Because even if you're very healthy, there's still so many things that you have to think about and do.
So interesting. And when you're kind of thinking about, when you've kind of worked with different customers, what have you found their challenge to be before they bring you on? Like, what are they really struggling with?
I think a lot of our initial use cases were around the really disengaged patient. So we have a use case, a case study that I'm really proud of, but it's people with diabetes who had done nothing within the health system for 2 to 3 years. So not a good thing if you have a diabetes diagnosis to have not seen any of your providers or anything in that period of time. And we were actually able to get 60% of those folks to come in and have a primary care visit during our pilot period. So really showing that we can overcome this disengagement. We recently did a market report with payer leaders, and they reported kind of the same problem as well. A lot of them said the biggest issue is they can't figure out how to motivate members to take action. I have a little bit of beef with that conceptualization as a behavioral scientist, because I think our job is not to motivate people as a verb, but it's to help them see how their healthcare connects to the things that they value. But that aside, I think a lot of the people we work with would say it's that disengagement. Now that we are getting more into like this air traffic control, intelligence capability in full, we're also seeing the fragmentation inside our customers is a big challenge for them. So they'll say, we can see how you can make a really big difference in this one area of our care, but what we're hearing from our patients is they're overwhelmed with fragmented communications from different departments. The right hand doesn't know what the left hand is doing, sometimes even within the same organization. We work with retail pharmacy where their data sets aren't unified with the clinics that they offer under the same roof. And so you might not know if somebody got a vaccination at the clinic, the pharmacy thinks that they're unvaccinated. And that creates some disruptions and roughness to the consumer experience. So it's a lot of that coordination across large organizations that have a lot going on and creating a streamlined patient experience so that we don't get to that place of disengagement. I think that's where our next challenges are really going to be.
As we're thinking to the future of precision nudging and patient engagement and what did you call it? Efficacy, self-efficacy. What is the next step? What's next for you guys? Are you going into new areas? Are we going to have new modalities? Like, what is your thought on that?
Yes and yes. So a really big thing that we're working on right now is growing global. Sorry, it's a little bit of a tongue twister, but we're about to launch our first international precision nudging in Costa Rica. We're doing some really cool work there with one of their major hospital systems. They're launching a wellness program that's really focused on preventive care and well-being. So aligned with some of the things that I believe are just truly important from the patient perspective. But, we have to grapple with the challenges of acculturation and really understanding a different healthcare system to build that effectively. So that should launch this summer. That will also push us into new modalities. So one of the learnings is in Costa Rica, like many other places, WhatsApp is a super common way to communicate. And it's actually considered one of the more credible platforms for a healthcare organization or a business to use. So we'll be moving into WhatsApp, among other new modalities. We're doing some work in the Middle East for the first time. So a different cultural context, as well as in Asia. And then, of course, the other piece is, again, really getting into the holistic patient journey. So I think we'll be talking less and less about our wonderful mammography case studies. Mammograms are still a really critical part of healthcare, and we'll still nudge people to get those screenings done. But the story now will be more about getting people to a better state of health, where mammograms are one ingredient in that.
Amazing. Now, my listeners love to learn about what's going on in the industry, but they also love to hear about you as a leader. What are things that you do in your personal life to help work your best and make a difference? You have a busy job, a busy career, you're changing the world. Like, how do you stay this strong?
Oh boy, that makes me feel like an imposter because I think there's so much more that I could do, but I try. I work from home as part of Lirio. It's a remote job. And actually, my entire team is remote, which is both good and bad. I think it's let us source just an incredible team in terms of talent. And because we're all remote, we're really good at remote first work practices and like building the personal relationships. Also, we're a team of behavioral scientists, so we overthink it. And I think we all know the importance of things like in-person opportunities. And so we try to build those in over the course of a year, make sure we all have a couple chances to see people, if not the whole team, at least subgroups of the team, and like build those relationships. For me personally, though, with the remote working, I leave my work phone in this room when I'm done working for the day. And I probably work way too late into the evening, but there does come a point where I say I'm stepping away and I can't access my work email or any of that on my personal phone. So it truly is like shutting the door on the work. I'm really trying to get better about sleeping adequately. So I bought an Oura ring for myself with my HSA funds at the end of the year last year. And I'm paying attention to my sleep data and trying to get those sleep numbers higher. And I'm finding that makes a big difference. And then, I think some of it is just making sure I can indulge in some favorite hobbies. I love to read, but I also particularly love to read like crap. So murder mystery novels, popular fiction, like things that are definitely not intellectual. They were laughing at me recently because we did an icebreaker at Lirio for one of our all company meetings where people submitted photos of their Zen. And then somebody showed the photos anonymized and people had to guess. So I had a picture that I took while I was laying on the couch. I have 3 cats and the cats were all on top of me and I was reading a book. And I picked the picture because of the cats, not realizing that you could see the book I was reading. And it was the Britney Spears autobiography.
That is amazing.
So I outed myself big time, but that's what keeps me sane. Like I need to have something that feels totally unserious to sort of let my brain go and not ruminate on the work stuff.
I love that. And it's such great advice for those of us that are just have our work phone on us all the time and can't put it down. And it's like, no, successful people know that you have to respect that downtime. Even if you are working hard and you're working over hours at the time that you are off, you need to respect it and enjoy it. And if you could give your younger self a piece of advice as you look back on your career and your life, like what would you tell yourself?
Yeah, this is actually advice I'm trying to give my current self because I look at my younger self, but it's not stressing. I think stressing can be important sometimes because we do need to take the challenges in front of us seriously and step up in some instances and work really hard to push through things that are hard, but not letting that stress get into my heart. And I mean my heart in the metaphorical sense there, because I was just saying to someone on my team yesterday, I think back to 2 years ago, and I know that I was really stressed out, but I couldn't tell you what I was stressed out about specifically, because those challenges do pass you by. And at least for work, like most of the challenges really aren't personal. It's like we have a client who has a need that is going to be difficult for us to live into, and we're going to have to pull together and work into it. But that doesn't need to reflect on my self-worth or my feeling okay about how the team is running. And so I'm just trying to remind myself as each day passes that I don't need to take the stress so personally. I should just sort of lean into it as a way to get through this hard time. And then also remember that stress is only valuable if you have those rest periods afterwards for regrowth. And this is something like when I worked for J&J, we talked a lot about this because any learning, any growth, it's periods of stress with periods of recovery alternated. Constant stress leads to burnout and no stress leads to complacency. So like just putting that stress in the right bucket is the advice that I would give myself. I would go back to grad school and like not lose my hair out of stress. Like I was actually losing hair for a while in my second year prepping for comps and everything. Didn't need to do that.
So to finish this conversation off right, where can our listeners find you online?
Mostly these days I'm on LinkedIn. I've actually quit a lot of the regular social media. I found it was getting really stressful for me, but I am still on LinkedIn. Lirio.com. We are doing blogging and posting some of our findings and papers there as well. And I do have a personal website, although I haven't really put much on it. It's amybucherphd.com. I'm trying to redesign it a little bit, so you can find me there too.
That's terrific. Now, before I forget, did you happen to bring tea with you today? And tell me about your mug.
I did.
Awesome.
I love drinking tea. I have to tell you, Grace, I stressed out a little bit about this because I wanted to have like an amazing story for you. But the fact is, I drink coffee and I drink tea, and I drink them in different mugs. So this is my tea mug. And I'll turn off the blur in case anyone can see this.
Very
So
nice.
I like a tall, skinny mug for tea because it keeps it hot longer than a mug with a wider top. And I like to have my tea at a not burning hot, but pretty hot temperature. And I also love the way that this pattern feels. Like, it just feels nice on my hands. So I'd say I like this mug because it just works for tea. My coffee mugs tend to be a little bit more fun and have logos and stories of where I got them. But honestly, this is my favorite tea mug.
That is a solid tea mug. So I like it and I want one. So it's great. And I do like that it has a design on it and you can just it's very nice to hold.
Yeah, I think it was a TJ Maxx special. I can't remember where I got it, but it is, if I'm having tea, it's in this mug. I have 2 of them, so I can alternate.
Too good. Well, thanks so much for joining us today. It was awesome having you on the show.
Yeah, thanks for having me.
And thanks to you folks for joining us too. Check out the HITea With Grace podcast for more great interviews with great guests like Dr. Amy today. Cheers.
Like a Girl Media is more than a media network. It's a community. We want to meet you and amplify your voice and the voices of outstanding women innovating in healthcare. Interested in starting your own podcast or hosting an event near you? Connect with us online or in person. We're here to support and empower you.